Hello, Dr. David. This is my video essay response for the viral diseases chapter. Your first question is, why do some states require a test for antibodies against rubella for women before issuing a marriage license? Well, it is not uncommon that during marriage, a couple may want to have a baby, and a woman can contract rubella during pregnancy, which causes what is known as congenital rubella syndrome, which is also harmful to the fetus. There is a 15% mortality rate to the fetus and a 35% incidence rate of serious fetal damage, which includes but is not limited to deafness, blindness, heart defects, and mental retardation. Your second question is, a patient has been diagnosed as having pneumonia. Is this sufficient information to begin treatment with antimicrobial agents? Briefly discuss why or why not. The short answer to this question is no. Many different organisms or factors can be causing the pneumonia, including gram-positive bacteria, gram-negative bacteria, or even viruses. Each of these organisms is sensitive to different antimicrobial agents while also being resistant to other antimicrobial agents. And not all antimicrobial agents will yield results because they may be ineffective towards that certain organism or factor. Your third and final question is, why might the influenza vaccine be less effective than other vaccines? Well, according to the CDC, there are really two major factors to account for this. The first being, it depends on the characteristics of the patient receiving the vaccine, including things like age, pre-existing conditions, and just overall health status. If that patient's immune system is already suppressed, the vaccine may not necessarily compensate for the lower health status, and that patient specifically will still probably be susceptible to or contracting the influenza virus. And the other factor, according to the CDC, is it depends on the match or similarity between the virus in the vaccine and influenza virus or viruses that are circulating around in the real world. Flu virus characteristics vary year to year and can have a direct impact on the effectiveness of the vaccine. Things like evolution and mutations can occur over the year and vary from year to year that will render the vaccine less effective than normal. Thank you.